get ready to take control of your healthcare. Here's your host, Ray Kober.
Hey people, Ray Kober coming at you. So this is going to be a little bit of a different type of show today. I want to talk to you about last week's Senate committee hearing on the MAHA, the Make America Healthy Again agenda, and the grilling of Secretary Kennedy. I don't know what you thought, if you had an opportunity to see it. If you didn't, I'm going to share some insight with you here today. But I've always contended that whether you're left or right, Democratic, Republican, regardless of your party affiliation, we're being lied to. And so I know that tensions are super high. There's a lot of contention right now, a lot of pent-up anger, fear, uncertainty, doubt. And we're a divided country. I don't think there's any question about that. But when it comes to our healthcare, this is not a political issue, but there are powers that have extreme influence over media. And if you're getting your news from Facebook or Instagram or any other social media outlet, or any of the major news outlets for that matter, it used to be that once upon a time you could depend on Walter Cronkite, let's say, as a journalism, someone who had integrity. And there was no doubt that he was reporting the news. We've gotten so far away from that today. And I'm really frustrated because if you do the research and you do the digging, it shines a completely different light on things, and it gives you a completely different perspective than what we're being presented with. So while I will share with you that I do have a bias, I do support Secretary Kennedy in this, I want to do my best to give you the evidence to come to your own conclusions. And for the record, not that I owe you this, but I've voted Democrat, I've voted Republican. I am typically someone that will look at who is running for office, and I'll make the best decision that I can with the information that I have for the person that I think is best suited for the job. Having said that, I want to share and take you into the CommonwealthFund.org, and they put out a report every year on kind of the state of healthcare worldwide and where we rank. And so the title of this report, Mirror, Mirror 2024, A Portrait of the Failing U.S. Health System. So this is really significant because if you dive into this report, what you'll find is that amongst the 10 leading industrialized nations, Australia, Canada, France, Germany, the Netherlands, Sweden, Switzerland, the United Kingdom, and the United States ranks dead last. And they have a system of doing this, and the only thing that we seem to do fairly well, we're ranked 2 out of 10, 2 being the best, is care process, whatever the hell that is. And so here you have United States lags its international peers considerably on health system performance. We're at the bottom of the barrel. You know what we're really good at? Really good at spending money. So while we're the worst, we spend far more than any of these other nations. In fact, U.S. healthcare spend has gotten to $5 trillion in the United States. It's roughly 20 cents of every dollar. And so this is something that we really need to get a handle on. But as you look at these committee hearings, as you listen to the Senate committee hearing and the badgering that the witness, Secretary Kennedy, is the beating that he's getting, I want you to keep these numbers in mind and just ask yourself a common sense question. If all of this money is being spent to support our politicians in their campaigns, how can we depend upon the rhetoric that they're spewing? I think that's a fair question to ask. And so another website that I'll share with you is opensecrets.org. And if you go there, you can find out how much money is being contributed. So in the interest of time, I'm just going to take you down the pharmaceuticals and health products recipients page. And, here we have Kamala Harris, who collected far more than any other candidate, last year. She was running for president, and her campaign received $8.6 million from this one lobbying group. President Trump, then candidate Trump, received $1.4 million. And you see our other senators and congresspeople that are listed here, all in the six figures. And so there's a huge conflict of interest here. And you can't tell me that it's not having an impact. It's definitely having an impact. And if you go and you look at the big picture of, what's going on here in terms of the pharmaceutical industry in 2024, and you look at the totals, here we go. Oh, this is not the one I wanted. Excuse me. Let's get it right. Yeah, there we go. $388 million is being spent just in pharmaceutical and health products lobbying. $388 million. Gee, do you think the pharmaceutical companies want to keep things just the way they are? Or do you think they're spending all that money because they want to serve the American people? I think it's pretty obvious. So as you kind of watch this testimony, as you listen to this testimony, I just want you to keep this top of mind, because we have to do better. There is a way to reverse this trend. There is a way to cut our health expenditures in half, and there is a way to get much, much, much better outcomes so that the United States is not spending the most and lagging the rest of the world. But it's not going to happen if we keep things kind of business as usual in the same way. And so whether you're a Democrat or a Republican, I encourage you to get involved, have a voice, and don't believe the fear mongering that's out there. Secretary Kennedy is not anti-vax. He says it multiple times during this hearing. Read his book, The Real Anthony Fauci. Listen to his interviews. And what you'll find is that he supports vaccines, but he also supports ensuring that every American citizen have access to the facts. And the facts have been hidden from us, and that's just a truth that no one can escape. So without further ado, I'm going to give you just a whirlwind tour of the Senate committee hearing last week so that you have a sense of what went on. I think you'll have a sense of my frustration. And I stand committed, whether you're a Republican or you're a Democrat, you're a fellow American, and we need to do better. We need to do better for ourselves. We need to do better for our families, our children, our neighbors, our friends. We can do better, and we will do better. And I, for one, support Secretary Kennedy.
This hearing will come to order. Today we meet to hear from U.S. Department of Health and Human Services Secretary Robert F. Kennedy Jr. about President Trump's 2026 health care agenda. Mr. Secretary, thank you for being here. We know that chronic diseases such as heart disease and cancer and diabetes are some of the leading causes of death in America. Now the department has a renewed focus on tackling the root causes of chronic disease and promoting prevention first. I look forward to exploring ways that the federal government can further align payment incentives to support healthy living and fight chronic disease. Mr. Secretary, I look forward to hearing from you today about the administration's efforts to make America healthy again and how we can continue to work together to achieve this shared goal. Thank you very much. Senator Wyden.
Thank you, Mr. Chairman. As the committee gathers today, the United States is in the midst of a health care calamity. The largest cuts to American healthcare in the history of our nation, and they are approaching like an avalanche. Last week, most of the senior leadership at the Centers for Disease Control and Prevention were fired or they resigned after refusing to bow to Robert Kennedy's unceasing crusade against vaccines. I traveled across Oregon last month, and the message was the same from one end of the state to the other. Families are confused. They're scared about who to trust about their health care. Robert Kennedy and Donald Trump have done so much to feed that mistrust. Just last week, he threatened doctors that deviated from the new anti-science vaccine guidelines he released that make it harder for pregnant women and children to get the COVID vaccine.
We'll get to the bottom of your accusations, but at this point, I'm going to turn to our witness, the Secretary of Health and Human Services, Robert F. Kennedy, Jr. And Mr. Kennedy, Mr. Secretary, you may make your opening statement at this time.
Thank you, Chairman Crapo, and thank you, Ranking Member Wyden, for the invitation to appear before the committee today. Let me start with the big picture. Under President Trump's leadership, we at HHS are enacting a once-in-a-generation shift from a sick care system to a true health care system that tackles the root causes of chronic disease. Chronic disease has reached crisis proportions in our country, and finally, we have an administration that is taking action. The MAHA report assessment, which the White House released in May, was the first government analysis of the key drivers of childhood chronic disease: ultra-processed foods, chemical exposures, physical inactivity, and over-medicalization. This month, we will follow with the MAHA report strategy, the Trump administration's solution for addressing each cause. At HHS, we haven't just been writing reports. We have been the busiest, most proactive administration in HHS history. In just half a year, we've taken on food dyes, baby formula contamination, the grass loophole, fluoride in our drinking water, gas station heroin, electronic cigarettes, drug prices, prior authorization, information blocking, and healthcare interoperability. We're ending gain-of-function research, child mutilation, and reducing animal testing. We are addressing cell phone use in schools, excessive screen time for youth, the lack of nutrition education in our medical schools, sickle cell anemia, hepatitis C, the East Palestine chemical spill, and many, many others. At FDA, we are now on track to approve more drugs this year than at any time in history. I'm also proud to say that HHS under President Trump is doing more with less. We have taken measures to fight waste, fraud, and abuse. Just by eliminating duplicative enrollments in CMS, we are saving taxpayers $14 billion a year. Meanwhile, we are expanding access for people who need it. We are ending racist diversity, equity, and inclusion practices and instead focusing on aiding low-income and vulnerable families, regardless of their race, which was the original intent of Title X. We're also pouring $1 billion into Head Start and the Administration for Children and Families. Compassion need not be the casualty of efficiency. I'd like to highlight some issues that have not gotten media attention. First, we are doing our part to fulfill the President's commitment to stop human trafficking, especially of children. We inherited a terrible humanitarian crisis from the previous administration with its open border policies, which allowed the appalling loss of 476,000 unaccompanied children. We have implemented policies now to ensure that that appalling tragedy can never happen again. We have knocked on 82,000 doors and located 22,000 of those children. I promise you that we will do more in the next 3 years. We are also addressing the disastrous health conditions in tribal communities on Native American reservations. I've met face-to-face with tribal leaders in dozens of communities and tribes in Alaska, Arizona, Idaho, New Mexico, and elsewhere. And I look forward to making HHS resources more available to those communities. One of the most significant initiatives under President Trump is the Rural Health Transformation Fund, part of the president's big, beautiful bill, which will provide the greatest investment of federal money into rural health care in history. Finally, I would like to address the recent shakeups at CDC. These changes were absolutely necessary adjustments to restore the agency to its role as the world's gold standard public health agency with the central mission of protecting Americans from infectious disease. CDC failed that responsibility miserably during COVID, when its disastrous and nonsensical policies destroyed small businesses, violated civil liberties, closed our schools, caused generational damage in doing so, massed infants with no science, and heightened economic inequality. And yet all those oppressive and unscientific interventions failed to do anything about the disease itself. America is home to 4.2% of the world's population, yet we had nearly 20% of the COVID deaths. We literally did worse than any country in the world. And the people at CDC who oversaw that process, who put masks on our children, who closed our schools, are the people who will be leaving. And that's why we need bold, competent, and creative new leadership at CDC. People able and willing to chart a new course. As my father once said, progress is a nice word, but change is its motivator, and change has its enemies. That's why we need new blood at CDC. That's also why it's imperative that we remove officials with conflicts of interest and catastrophically bad judgment and political agendas. We need unbiased, politics-free, transparent, evidence-based science in the public interest. Those are the guiding principles behind the changes at the CDC, and that is what you can expect all across our agency for the next 3 years. The principal preoccupations, not only of Republican senators when I did my confirmation hearing, but also almost equally among Democratic senators with the crisis in rural health. We've had 120 rural hospitals close over the past 10 years. These institutions are not just delivering health access to rural Americans, but they are economic centers, they are cultural centers for those communities. They are often the largest employer. They are the highest paying jobs, and they are the centerpiece for those communities. So when they die, the communities collapse. And President Trump promised to do something about that, and he has delivered on that promise. Right now, we spend about 6% of Medicaid funding is sent to rural hospitals, a very, very tiny slice, and that's one of the reasons they're in trouble. President Trump has now allocated through the One Big Beautiful Bill $50 billion, so $10 billion a year over the next 5 years. What we give to rural hospitals, that 6% represents $19 billion a year. So we're increasing that by $10 billion. So we're infusing more than 50% increase in the amount of money that is going to rural communities over the next 5 years. There's never been anything like that in history. It is the biggest investment, and it should stem this hemorrhage. Yes, Senator, you know, this morning I got the latest numbers from CDC that 76.4% of Americans now have a chronic disease. This is stunning. When my uncle was president, it was 11%. In 1950, it was 3%. Today, it's 76.4%. 8 out of 10 of our kids cannot qualify for military service. This is a national security issue. When my uncle was president, we spent zero on chronic disease. Today, we spend $1.3 trillion. It's the biggest cause, and it's increasing. And all of the arguments that Republicans and Democrats have about single-payer, Obamacare, or the various ways of allocate the health dollars, they're all like rearranging deck chairs on the Titanic. If we don't end this chronic disease, we are the sickest country in the world. That's why we have to fire people at the CDC. They did not do their job. This was their job to keep us healthy.
Thank you,
and I need to fire some of those people to make sure this doesn't happen again.
Thank you, Mr. Secretary. I have to cut myself off to make sure I keep to this time frame too. Senator White.
Thank you very much, Mr. Chairman. I've made it clear I think that Secretary Kennedy is dead set on making it harder for children to get vaccines and that kids are going to die because of it. And Mr. Chairman, I'd like to put into the record today an op-ed written by Susan Monarez, who was fired by Mr. Kennedy.
Without objection.
And now the American Academy of Pediatrics has warned that the committee is being politicized at the expense of children's health. American Academy of Pediatrics, you think they're lying too?
I think the American Academy of Pediatrics is gravely conflicted. They get, their biggest contributors are the 4 largest vaccine makers. They run a journal, Pediatrics, which they make a lot of money on, that is completely dependent on pharmaceutical companies. So I wouldn't put a big stake in what they say that benefits pharmaceutical interests. Senator, I didn't politicize ACIP. I depoliticized it. The Congress has been investigating ACIP.
All over the country, Mr. Secretary, scientists and doctors are saying otherwise. They're all wrong, too. They're all lying, according to you.
The scientists and doctors are supporting me all over the country. There is division on opinion.
I don't get letters from thousands of people who are not political saying that this set of changes is going to damage American healthcare, and particularly these healthcare agencies, for decades to come. I don't get any letters from people saying, hey, this is going to make a big difference forever.
Maybe you're listening to a selective group of people.
Well, you get me some.
Yeah, and I will.
Fine.
I will tell you what, Senator. I will put my mailbag against your mailbag any day of the week.
The record that they're going to rely on to make these decisions, will you make it transparent for the American people?
All the evidence is transparent.
Will you make it in advance transparent for the American people so they can comment on it?
All the evidence is transparent for the first time in history, and you were never there complaining when the pharmaceutical companies were picking those people and then running their products through with no safety testing.
You can characterize it any way you want. I quoted them today. What I said was accurate. What you said were lies. You described people moving the Titanic.
Senator, are you saying that a mRNA vaccine has never been associated with myocarditis or pericarditis in teenagers?
I am simply.
Is that what you're trying to tell us?
I am simply trying to say that the people that you have put on that panel, after firing the entire.
You're evading the question.
No, I'm asking the questions here,
You're
Mr. Kennedy.
evading that question.
I'm asking the questions, Mr.
I asked
Kennedy.
You a question.
I'm asking the questions for Mr. Kennedy on behalf of parents and schools and teachers all over the United States of America who deserve so much better than your leadership. That's what this conversation is about, Mr. Chairman.
Senator, they deserve the truth, and that's what we're going to give them for the first time in the history of that agency.
Well, thanks you for your willingness to serve and for putting up with this abuse. 5 minutes is even close to refute all the falsehoods that have been confidently spewed during this hearing. We'll talk about real data here, okay? Well, first of all, thank you for breaking the logjam of information of HHS. My committee's got now over 8 million pages of information. Just in the first tranche, by the way, what we discovered is that the CDC, somebody in the federal health agencies, this interagency communication, hid the signal. They admitted there was a signal on myocarditis, and they hid it. They didn't warn the public. They didn't warn doctors. So that's just one instance of corruption and lies told by the CDC. We've got a lot of others we'll be rolling out, okay? So we held our first hearing and permanent subcommittee investigation on that hiding of the signal of myocarditis. We've heard a lot of studies, okay? As I've looked into science, it's been thoroughly corrupted. Here's data, and I'd like to enter this sheet into the record. I've been publishing this chart for, since really early 2021. When I'm on, for example, talk radio shows and they talk about this, they get deplatformed, or they were, because of all the censorship during the Biden administration. Here's the facts. The VAERS system that was touted in October of 2020, this great safety surveillance system on COVID, a few months later, when they didn't like the results, they started denigrating their own system. But VAERS shows that there have been 38,742 deaths reported on VAERS worldwide associated with the COVID vaccine. 38,742. 9,252 of those deaths occurred on the day of vaccination within 1 or 2 days. Again, I agree with you. Nobody knows how many COVID deaths were because the information was completely corrupted. Nobody knows how many lives were saved by the COVID. I think most people, okay, if you're vulnerable, raise your antibodies, reverse severity, fine. There's not any good study on that. There's just information out there, just claims being made. This is hard evidence. And certainly what I've been advocating for are the injection injured, the childhood vaccine injured. We're going to be holding a hearing next Tuesday on a study done by a high-integrity healthcare facility that shows, that actually looked at vaccinated versus unvaccinated, very high-quality study. I'm not going to steal the thunder of Aaron Seary, who's going to be testifying on this. I think you're aware of this study that shows the vaccinated population far more prone to chronic illness than people completely unexposed to vaccines. That is just one example of how science has been corrupted by the way, the study was conducted, and when they conducted this, oh no, no matter what the results are, we're going to release this. They got the results in 2000. It is yet to be released. We're going to enter that in the record on Tuesday. Do you want to just talk about what you've witnessed in terms of the capture of the agencies that you're now in charge of, the corruption of science, which I believe you just said, that is almost your number one goal, right, is try to bring integrity and credibility back to science, which has been corrupted by the people who pay for it, by federal health agencies being captured by pharmaceutical industries, by big pharma, by big food. Just, I want to give you, I'm sorry, just the last minute to, first of all, defend yourself, but talk about the corruption of science that you're having to deal with and trying to correct.
Yeah, I mean, I'll just tell you one example, and I could sit here and give you thousands. But in 2002, CDC did an internal study of Atlanta and Fulton County, Georgia children, and looked at children who got the MMR vaccine on time and compared those to kids who got them later. So in other words, kids who got them before 36 months and kids who got them afterward. The data from that study showed that black boys who got the vaccine on time had a 260% greater chance of getting an autism diagnosis than children who waited. The chief scientist on that, Dr. William Thompson, the senior vaccine safety scientist at CDC, was ordered to come into a room with 4 other co-authors by his boss, Frank DiStefano, who's the head of the immunization safety branch, and ordered to destroy that data. And then they published it without that fact. So you know that story, I know that story, and you know of hundreds of stories like that. It happens all the time. We are being lied to by these agencies, and we're going to change that right now. CDC have been asleep at the wheel. Right now, we are doing those studies. We're doing extensive studies so that we can warn parents and so that we can force the companies to put labels on their products. And, we'll do whatever we can to show that, just to get data out to the public. That's really what our function is. And to show what the long-term impact of some of these drugs is. Are we actually preventing suicide or are we creating more suicide? And that's something that we don't know the answer to, which is, how did these drugs become become so common in our society without us even knowing the answer to those questions. That is malpractice at these agencies, and that is the malpractice that I am going to fix.
Thank you.
I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you?
Primary advisors are Marty McCary, Jay Bhattacharya, Dr. Oz, Vinay Prasad.
So you got a few doctors who agree with you, and I'm giving you the
Not
name.
a few doctors. What you're talking about is there's a big difference, Senator, between established science and the scientific establishment, which has been co-opted by the pharmaceutical industry.
So you're telling the American people that the American Medical Association, representing hundreds of thousands of people, have been co-opted and that they should not trust their doctors.
And I'm
the
telling
American
you,
Academy of Pediatrics, and by the way, just for the record, every single Republican, I don't mean to be political here, Mr. Chairman, has received PAC money from the pharmaceutical industry. Are they all corrupt as well?
And I'm telling you, the American Heart Association has been co-opted by the food
Everybody
industry.
but you, Senator. But you know what? When you ran for president, we have a corrupt campaign finance system. Maybe you will agree with me on that. Okay, you were already president, you got $1 billion behind it. You received $300,000 from people, not from the industry, people in it, as I did, from individuals. You corrupt. President Trump got $3 million. Every Republican got corporate PAC money for the pharmaceutical industry. Democrats as well. Everybody is corrupt, but you? Is that what we're looking at? I don't think so. And I think the issue now...
I don't even know what you're talking about.
Well, I think you do know what I'm talking about.
I don't know what you're talking about.
The issue is every time anyone disagrees with you...
Are you saying the pharmaceutical industry was supporting my presidential campaign?
No, I'm saying...
I don't think so.
I'm not saying that. I'm saying that the pharmaceutical industry is a greedy institution which is charging us the highest prices in the world. They are pervasive. But to suggest that every institution, the AMA, the pediatrics people, is corrupt because they disagree with you is an insult to the American people.
Listen, people disagree with me all the time. I have arguments in my agency, heated arguments every day with Jay Bhattacharya, with Marty McCary, with Dr. Oz.
You have given the names of a few people. I have given you the names of organizations representing hundreds of thousands of doctors and scientists.
Will you commit to sharing the protocols used for the autism study with Congress and to the public?
They're public.
Will you commit to giving it to this committee by the end of the week?
No, not because that's not the way it works.
Will you
don't even know what you're talking about.
Mr. Secretary, will you commit to sharing the protocols for this study by the end of the month?
We already have put out...
You just said it's public.
We put out the notice of funding opportunities, and then the scientists from all over the world.
You're not understanding me. Let me say clearly
you're not understanding how the world works.
Do you understand what the protocols are? Do you understand what they are?
The scientists who are doing the studies submit the protocol.
Okay, so you know what they are.
That's not coming from us.
So will you commit to sharing those protocols with this committee?
Well, anybody can get a hold of the protocol. It's published with the study.
Mr. Chairman, what I'd like to ask is for your commitment here. I'll send a letter to the Secretary. I'll ask for support from the leadership of this committee to ask for those protocols. Good. If those protocols are not given to this committee...
Anybody can get the protocols.
Mr. Secretary, I'm not talking to you. Mr. Chairman, what I'm asking...
If the protocols are public, we can work with you to...
What I'm asking, Mr. Chairman, is that if those protocols are not given to this committee, I'm asking for your agreement that we follow through with the subpoena to get them.
No, I will not agree to subpoena anything. Let's see what happens.
Mr. Chairman, you'll help me get them if they're available publicly?
Yes.
I appreciate that, Mr. Chairman. Mr. Kennedy, with all the questions here today, people just want to know the truth.
I don't think so.
Mr. Secretary, you don't think so. Thank you.
I don't think so.
I hope everyone recording that got that, because there explains the Secretary's tenure here. Look, 2 young ladies in Las Cruces, New Mexico at a town hall recently gave me this starfish pin. I was going to give it to you today, but after your questioning today, I don't think you deserve it, because what this represents is to remember that every one of us can make a difference, sir, to something as small as a starfish on a beach that maybe got washed up, you throw it back in the ocean. You might not save them all, but you can save one. I'm sorry that you're not worthy of this nice little pin, sir, as a nice reminder. I'm going to pray for you, Secretary Kennedy. I hope we do better. I want you to do better, but today was a failure for you, man. I yield back.
You can't make this stuff up. You just can't make this stuff up. A starfish pen? Really? So it's a pretty sad state of affairs when that's what's going on in Senate committee hearings. Our taxpayer dollars at work. At the end of the day, I encourage you to make your own decisions, but make sure that you have the facts, because what the media presents and what reality is are two completely different things. There is a ton of corruption throughout the healthcare system, and I'm not here to throw all of our politicians under the bus, but they are all complicit in accepting PAC donations from the spectrum that is healthcare. And we're talking big, big money, as you saw. We have to do better, folks. Secretary Kennedy is an agent of change. If you want to cling to what the media is spoon-feeding you and that he's an anti-vaxxer and he's going to be the death of this nation, well, guess what? We're already in pretty bad shape. So if you're worried about Secretary Kennedy making things worse than they already are, you might want to worry about something else. In the meantime, I hope this was helpful. This is just a condensed version of what went down. And if you want to see more videos like this from us, let us know. But I felt a personal duty to bringing this to you because the facts, were not clearly presented in that committee hearing, and we could do better. So until next time, we'll see you on the next one. Take care.
All right, that's a wrap. Hit like, follow, and subscribe, and we'll catch you next time.